Brian Beaversel, and you're watching PHTV4 Living Well. And on Living Well, we look at a variety of topics related to living a healthy lifestyle. With me today is Dr. Brian Gambla of Gambla Dental. Dr. Gambla, thank you for being here.
Good morning.
We're going to get some tips on dental care today. Something we're all dealing with all the time, so we appreciate you coming in. And I think we're going to talk about cavity assessment, right?
Yes.
Interesting, I don't know if it's possible to avoid cavities over the course of a lifetime. I mean, I hope somebody found a way to do it out there, but I know it's not me. I go back to, I have silver in my mouth, and those are getting replaced over time now. But can you talk to it, like how do you assess a patient for risk of cavity so that I'm guessing that will affect a plan for helping them avoid it?
Sure. We aim for a long-term plan with this. So usually I break it down into just age groups. You know, you get the adolescents, you get the youth, you get the seniors. So with each demographic, we basically know there are certain things that people are at risk for. So especially with the decay. So then we kind of plan our game plan accordingly.
So it's interesting because cavities are not a one-size-fits-all. The cavity is itself, but what could cause it or put you at risk will change over the life. So as an example, what are some of the differences that put, like you recognize this 3, 5, 6, 7-year-old as a greater or different risk than like an adolescent or an adult?
Absolutely. 3 to 7, 3 to 8, a lot of times it's more diet and lack of brushing. That's what comes into play. With an adolescent, we go into diet, but it's a different type of diet because the kids can start making their own choices as far as what they want to eat. A lot of times there's a lot of unhealthy choices there. So we have to kind of get that all lined up. With seniors, a lot of times it's just things like dry mouth, side effects from medications. There's just an array of things that way that can happen.
So when you see those different factors in play, that's going to change how you...
That will dictate what direction we go with each person. So what we want to kind of advise them, you know, just potential pitfalls that they could be aware of.
Okay. So you mentioned like the dry mouth for a senior, because I'm thinking, I didn't hear the other stuff. I only heard what applied to me. But in talking about diet, can you give us some examples of what those kind of, I get like young people, maybe they don't brush as often as they should, or as well. I can imagine it with a 5-year-old very easily.
Yes.
What other types of maybe dietary things, I'm thinking about teenagers, they're off with their friends or they're at school, they're buying what they want to buy, their choices. What kinds of things are increasing risk factor for cavity?
Number one would be pop. Pop is highly acidic, so people they love to drink it, but it really is just damaging to the teeth. Another thing for, say, like an older person, we get into hard candies. They think sugarless candy is really advantageous for them because it keeps the mouth moist, but a lot of it is the same type of thing. It's acidic, so that can cause tooth decay.
That's it. I was going to ask you about that because, like, you think of pop, we think of the real high sugar content, which is, I'm sure, not good, but that's not the only problem with pop. It's the acidic quality to it.
Yes.
I'm going to guess that applies to other types of things that people drink too, then.
Especially like energy drinks. I mean, it's very close to battery acid at that point. I mean, it's extremely acidic.
It's a pretty powerful visual there.
It is. I mean, it's very acidic, very damaging. So, and a lot of the kids love that stuff because it does give them a lot of energy, but there's a lot of side effects to it that are not so good.
So my final question for you then is going to be, you know, then how do we mitigate, I'd like to say, all right, you're not going to drink pop anymore, but, you know, orange juice. I like orange juice. It's acidic.
Yes.
But it's also healthy for me in some ways, too.
Absolutely.
Right. Or maybe a person needs an energy drink or a power drink or whatever after a hard workout. So the thing is still going to happen. What can they do to mitigate the...
You know, I'm a pretty reasonable person. I always look at you want to do things in moderation. So, you know, it's not that you can't have these types of things in your life. It just, you can't go crazy with them. Being more excessive about these behaviors, that's where you run into trouble.
Okay. So moderation, and I do want to ask, because I adopted this only because I felt like I should. I don't know if it's a good idea. I mean, even just rinsing your mouth with water after, like, let's say I can't
Yes.
brush, but hey, I can rinse my mouth. You know.
Rinsing is very effective. I mean, just with basic water. I mean, it really does help to neutralize everything.
Okay.
So that's a great tool that you can employ.
Okay. Okay, so we're going to be mindful of our diet, mindful of what we're drinking, moderation, all good advice. Rinse when possible if you're not able to brush maybe in that moment, which is going to be my final. Any other things that people should be doing to help reduce their risk for cavities?
Sure. This is an obvious one. I mean, you do want to visit dentists regularly because they can really intercept things when it's small and more minor than getting more involved later on. So I honestly really believe that seeing the dentist frequently is a good idea. But then also late night snacking we got to watch out for. And just before you go to bed, just make sure you really brush and floss. Get everything very clean before you go to sleep.
Okay, yeah, you don't want those little food
Everything-
particles or whatever you drink sitting on your teeth overnight.
Exactly.
That's trouble. Okay. Dr. Gamble, thank you very much. Really good advice. I like good distinctions between the different risk factors at different stages of your life.
Yes.
Thank you.
Thank you.
I'm Dave Worsley. You've been watching PHTV4 Living Well. We've been talking with Dr. Brian Gambla of Gambla Dental. Thank you for watching and be healthy.